Today I'm going to talk to you about contraception after the birth of your baby. After giving birth, you may feel that sex is the last thing on your mind. Your period may return as soon as 6 weeks after having a baby, as you can start ovulating if you're not breastfeeding or if there are any breaks in your breastfeeding. Contraception is something you need to think about if you want to delay or avoid another pregnancy. Many unplanned pregnancies happen in the first few months after childbirth. You can have sex after the birth of your baby when you have recovered from the delivery and you and your partner feel ready. It's best you start using contraception from 3 weeks after birth. Don't wait for your periods to return or until you have your postnatal check, as you could get pregnant before then. If you are fully breastfeeding, you can choose to rely on this for contraception. However, for it to be effective, you must be exclusively breastfeeding your baby under 6 months of age, day and night without any long intervals, and not have any periods return. Other options include male or female condoms as soon as you want to. The contraceptive implant can be considered from 3 weeks after birth. If you're not breastfeeding, then you can use the combined oral contraceptive or contraceptive vaginal ring. As these options can reduce your milk if you are breastfeeding, then you can instead choose the progestogen-only pill and start this anytime after birth. It is recommended you wait until 6 weeks after birth to start the contraceptive injection. Intrauterine devices, such as copper IUD or the Mirena intrauterine system, can be inserted from 4 weeks after vaginal or caesarean birth. You can also use a diaphragm from 6 weeks, however you'll need to check that it still fits correctly after birth. Natural family planning methods can be difficult to monitor for the signs and symptoms of fertility immediately after birth or when you're still breastfeeding. Which contraceptive method is most suitable for you depends on you and your partner, your medical history, any problems you may have had in your pregnancy, or if you are breastfeeding. If you're absolutely sure you do not want any more children, you may wish to consider sterilisation for yourself by a tubal occlusion or your partner by a vasectomy. If you do have unprotected sex more than 3 weeks after the birth of your baby, you can also seek the emergency contraceptive pill or have a copper IUD inserted within 5 days. I hope you found the information in this video useful.